Today we will be analyzing the assessment tool self-assessment. By the end of this presentation, we hope that you can determine if self-assessment is an assessment tool that you can implement within your own practice. Within the presentation today, we will define self-assessment, analyze the theoretical foundations and components that self-assessment connects to, identify some barriers to this tool, and how it can be implemented in an effective manner.
We came across many definitions of self-assessment because they change based on the objectives for which they're used, but at the very basic, self-assessment is a process where students describe and possibly assign merit to their abilities and the products and processes of their learning. And then a more complicated definition as we get into reflective practice, where students monitor and evaluate the quality of their thinking and behavior, and then use that information to identify strategies to improve their understandings and skills. The use of self-assessment emerged from the traditions of autonomous professional practice because there's an importance for self-monitoring and taking responsibility to uphold the standards of practice without being policed by outside persons. And the ability to self-assess is a competency in many regulated professions, and this is why education programs employ self-assessment to build the necessary skills for professional practice. This includes being a lifelong learner, improving the ability for self-directed learning, and increasing the learner's responsibilities for their own development. This occurs through metacognition, reflection, and feedback as students can assess their strengths and weaknesses, identify their achievements, and expand and analyze their professional development. Here we see the cyclical process of self-assessment that students engage in. It involves self-monitoring, which is paying deliberate attention to the thinking and progress as it is occurring. Self-judgment, which is identifying progress towards a targeted performance. They engage in this by relating to the established standards and criteria set out for them. So the standards are the benchmarks to aim for, and the criteria are the guidelines for interpreting the level of performance that has been demonstrated. And this helps students know what they know and what they still need to learn. And then students choose learning goals and activities to improve their performance, correct their misunderstandings, and extend their learnings. There are two approaches that can be taken when employing self-assessment. These are based on the desired learning objectives. The competency approach is used to look for the skills, knowledge, and abilities of students, and then the developmental approach is employed to help judge skills development for things like lifelong learning and self-regulation. And this aids in understanding and knowledge building and encourages personal and professional growth. Both of these approaches involve the use of self-reflection and feedback. Some characteristics that distinguish self-assessment from other assessment methods are that its uses extend beyond evaluating for cognitive learning, and it allows instructors to evaluate competency in characteristics that may not be visible in traditional assessment methods, like thought processes, communication, professionalism, values, and ethics. And when used as an assessment for learning, self-assessment triggers learning more in the affective domain, which involves feelings, emotions, motivation, and attitudes. Cognitive learning theory states that learning happens as individuals respond to stimuli through the mental processes listed below in this definition. More specifically, social cognitive learning theory states that individuals observe those around them to gain information, model the behavior from those observations, taking in the situational context, and then apply what has been learned into their own actions. This type of learning is affected by behavioral, environmental, and cognitive factors, so it is individual for each learner.
Constructivism is a learning theory which believes that individuals build personal constructions of knowledge based on their experiences, perceptions, existing knowledge, goals, and culture. Learning becomes an active and social process where new information is compared to previous understandings to give it meaning and reference. Within social constructivism, students are able to gain a deep understanding of improvements that need to be made within their professional development, such as communication and teamwork.
Metacognition is a type of complex learning that involves thinking about one's own thinking. It's the capacity to monitor, evaluate, and know what to do to improve your own learning. Students engage in this by checking their understandings, employing situational awareness, predicting the outcomes of actions, checking their progress as they move through learning, and other skills like time management, planning activities to improve your learning, and strategizing for future learning. The theory of self-efficacy talks about individuals learning about their behavior and performance. This type of learning happens gradually as external and internal information is gathered during experiences. This type of learning allows students to estimate what they are capable of and predict the likelihood of successful future performance.
There are two types of self-assessments. Formative self-assessments allow students to assess themselves during a specific incident or event. They are used to identify gaps and create learning goals and strategies to reach them. Summative self-assessments allow students to assess themselves over an extended period of time, typically through a variety of ways such as through assignments and clinical experience. Here are some examples of self-assessments which you may want to include within your own lesson plans. The benefits of self-assessments within education for healthcare providers is that it allows students to learn how to self-reflect once they graduate and begin practicing. This in turn helps them to continuously develop their professional practice. The ability for an individual to self-reflect correctly can also improve morale and encourage students to want to learn more in order to improve their performance and meet new learning objectives that they have created for themselves, resulting in improved professional skills such as communication and professional knowledge. Self-assessment has many great aspects for professional workers. However, it does hold its own disadvantages. From the aspect of a student, certain forms of self-reflections can be time-consuming on top of their other work. When not provided with a mentor, students can find themselves under or over-representing their skills, which can result in an inaccurate measurement of the student's abilities. Because of this, self-assessment is not an accurate tool to identify knowledge gaps of a student. From an educator's perspective, the disadvantages it may hold are that it is more prone to bias due to subjectivity. This can threaten the validity and reliability of the assessment tool. In order to prevent this from occurring, multiple assessors are required to grade summative self-assessments. This can be a lengthy process. Self-assessments are also very difficult to implement correctly.
So this slide is about the potential complications to implementing successful self-assessment and the threats to validity and reliability. The first category is acceptance. Students often like to be and expect to be assessed by trained experts. They may also see self-assessment as a burden of more work because they do not understand the objectives and the value of self-assessment. When talking about context and culture, the context under which an assessment is undertaken can influence the outcome. For example, if it's a high-stakes assessment, students may tend to emphasize their strengths rather than their weaknesses because of the grades. So complications with accuracy impact the reliability and validity of assessments. Students not knowing what is expected of them tend to affect validity. Self-deception can occur when students under or overestimate their performance. Studies have shown that high achievers tend to underestimate themselves and low achievers tend to overestimate themselves. Also, females often tend to score themselves more harshly than males. This can affect the reliability of grading. Students may also get defensive about poor performance and overcompensate on self-assessments. The impression management is also a factor. Overconfidence, optimism, or incompetence can affect outcomes of self-assessments. The final category is power, and this complication involves who sets the criteria for students and who sets the marking criteria. These can cause feelings of loss of control and autonomy in students, and some studies have shown that students should be involved in setting the criteria and marking schemes. These next two slides are an example from my experience in a dental hygiene program of what we would ask of students doing skills assessments on patient education for oral hygiene instruction. This could be used if they did not pass their initial competency and needed remedial, or in a practice session in the clinic. It begins by asking guiding questions to prompt students to reflect on their encounter with their patient, and then goes on to ask them to look at the criteria for competency and measure their performance against those standards. We'd ask them to state what went well, what they could improve upon, and how they could go about improving their performance next time. So maybe they need to review the lecture, review motivational interviewing techniques, or brush up on their interpersonal communication skills. I would also write notes as written feedback from observing them, and then this could be used to guide students to their study before their next clinical competence.
This is an example of a summative self-assessment that nursing students have to complete within their program. It's provided to them prior to clinicals, and students are aware that these are objectives that they should be developing throughout their clinical placement. As you can see within this placement, there are quite a number of objectives that they should start to be developing, such as effective communicator, critical thinker, and knowledge worker. Within each ability, for example, accountable for learning, learning objectives were expanded upon. Within the placements, there was a midterm and final where the student and educator would meet up and discuss what the student had observed for themselves and what the educator observed throughout the clinical placement. Having these meetings where students and educators discuss each other's observations allowed for the educator to identify with the student any under or overrepresentation the student might be doing within their reflective practice. It is important for educators to step back and take a supportive role for students in guiding and developing their reflective practice. It's important that educators receive continuous training on how to provide proper feedback to students, which will encourage growth and not discourage them. A great example of training mentors should have is the difference between positive feedback and praise. Feedback should be specific and not just "great work." It is essential for educators to ensure that if a student's self-assessment is graded, that it is calibrated. So what is the role of students when they are completing their self-assessments? First off, students should be using the learning objectives of a course and make judgments on whether they are performing to the standards set out by instructors. They are responsible for being honest while completing self-assessments. As mentioned earlier on in this presentation, self-assessments cannot work if students under or overrepresent their skills or achievements. Sometimes students don't actually do this intentionally, so it's important for students to seek out the resources available to them, like meeting with a mentor or educator, to ensure that they are assessing themselves correctly. Having discussions with their mentor or educator on the differences or similarities of what each other observes within the student's practice can help students identify if they are actually over or underrepresenting themselves. With the feedback that students receive, students should develop learning objectives to improve their skills. Bloom's taxonomy identifies the key components students should be able to complete when doing a self-assessment. Self-assessment promotes higher level learning in the apply, analyze, evaluate, and create levels of Bloom's taxonomy. Within the self-assessment practice, students demonstrate their skills and abilities, examine their actions, critique the events that occurred, and develop new learning goals and objectives.
Reflection is Reflection is an important component of self-assessment. It's best suited to formative self-assessments where students are given the opportunities to go back and improve their products or performance after engaging in reflection and feedback. It involves learners processing their experiences in many ways, exploring their understandings of what they are doing and why, and allows them to think about the impacts of their actions on themselves and others.
Multi-source Multi-source feedback is common in medical education. It results in more comprehensive feedback as different individuals may notice different things about performance. This makes the feedback more useful in application as individuals compare their self-assessment to the evaluation of other participants. Students are then able to react to the external sources of feedback and adjust their learning objectives and strategies to identify their specific areas of strengths and weaknesses. You might be wondering You might be wondering if self-assessment is the right tool for you and your students. Self-assessment is a well-suited evaluation to complement the use of student-centered teaching strategies such as experiential learning, problem-based learning, workplace learning, and clinical learning. It is essential that self-assessment be implemented in areas that are supportive of no-blame culture. This form of environment encourages honesty within an individual's self-reflection. Areas that do not have this form of environment will see students overrepresenting their skills and achievements within their self-assessments. To ensure that self-assessment is being implemented correctly within your classroom, educators should ensure that students are provided with the learning objectives for their self-assessments. Students should be aware of what skills they are trying to develop and why. Healthcare professionals have certain skills which should be upheld, such as the ability to effectively communicate and be a critical thinker. And as we have mentioned, there is an importance in the feedback in which students receive. This feedback should be done in a method that enhances learning and encourages growth.
Ensuring the validity of self-assessments involves the establishment of explicit and clear learning targets, defining evaluative criteria for students, providing them the tools for self-assessment, and allowing time for reflection. It is important to incorporate the learning objectives into the self-assessment for students and that they know explicitly what is expected of them. Providing evaluation criteria in the form of rubrics, models, exemplars helps students concretely understand the outcomes and expectations of them. They then begin to understand and internalize the steps necessary to meet those goals. We also want to ensure that students understand why they are completing self-assessments and see the value in thinking about their learning. To improve reliability and accuracy, we want to use multiple assessors who have been trained to have consistency in rating scales and who understand the definitions of acceptable performance. Feedback is a really big part of improving reliability. We want to provide students feedback not only on their performance, but on the quality of their self-reflections so that they can improve. The efficacy of self-assessment is not well documented in literature because its objective is to develop skills that are quite hard to measure. It is important that we present self-assessment as a valuable opportunity to students and that instructors provide clear objectives and criteria so that students can base their reflections off of expectations. When looking to the future, it has been suggested by reviews that self-assessment methods be explicitly taught to students so that they are able to connect what is expected of them and the value that it will have in future professional practice. Ability to self-assess and engage in self-directed learning is a vital part of health professions practice. Our research has shown us that it is a strategy that should be employed even in the most basic of senses to have students check in with themselves to see where they are in their learning and where they need to go.